Hi, it's Dr. Anthony G. Beck, and one of the things that I'm oftentimes quoted as saying is that not everybody is, of course, the same, which means we can't always be offering the same solutions to repairing one's ill health or complaints when it comes to not having your highest levels of well-being. Well, one of the things I wanted to do was give you a perfect example of that and really emphasize something I talk about quite a bit, which is biochemical individuality. And so many times a day, there's all kinds of gurus and bloggers and those that are putting out what I call the noise and confusion of the info space that are just really plaguing people as to why they're really not getting the most out of life or being able to resolve chronic diseases. And one of the reasons is because we're trying to give what I call grab bag medicine to everybody. Or oftentimes I talk about throwing a bunch of darts at the dartboard and hoping one sticks, much less hit the bullseye. Well, I'm up here in Iowa working with one of my particular patients, and one of those functional labs that I actually will do oftentimes with the patients based upon their clinical situation and complaints is actually take a look at some of the chemical burdens that are possible indicators of why they're having complaints of things like fatigue and insomnia, low libido, musculoskeletal pain, gastrointestinal disharmonies and complaints and things like that. So if we take a look at balanced protocol perspective, we all know that there's going to be only 5 causes of all disease known to mankind, which are nutritional deficiencies, stressors, allergens, toxins, or microbes. So one of the areas that I screen for are, of course, environmental pollutants and toxins. So what I want to do is give you a brief little peek at one of my patients' labs and then see what we actually found when I actually came here all the way up from Florida to Iowa to do an on-site visit for my patient and really do the CSI agent of health and really delve into his surroundings and find out what could be contributing to some of the chief complaints that he has. And the cool thing is we found one thing that's pretty doggone interesting that I bet most of you have also fallen victim to as well, unbeknownst to you. Let's go take a look. Okay, so I'm here in the kitchen of my patient, and I've kind of laid out the test results of one of the things we actually take a look at, all the way from chlorinated pesticides to PCBs to phthalates and parabens. And of course, we see some bioaccumulation of these nasty parabens that are in so many cosmetics and shampoos and conditioners and different products and sunscreens and stuff like that. So we've got some bioaccumulation going on here of ethyl paraben. But then we also have a little bit of benzene going on up here in the farmer's belt that tends to be quite common. But one of the things I just wanted to point out in this particular video are some of these organophosphates that we actually found. This test actually takes a look at both the blood and the urine as 2 sources of the body excreting some of these toxins that are actually bioaccumulating over time. And you can take a look and see that we have a couple of nasty ones, but one in particular thing that we're taking a look at is, of course, most people are trying to use water bottles that are bisphenol A free and things like that. We see this particular chemical, it's kind of ubiquitous in plastics and things like that. But one of the ones I really wanted to show you here was this chemical right here, triclosan. Now, my particular patient has an elevated bioaccumulation up in the 90th percentile of this particular chemical. But then the question is, well, where did that come from? Well, we can actually just kind of scan through the kitchen here and move on over to something that we oftentimes see, which is an antibacterial soap being used to wash dishes and things like that. And lo and behold, look at that active ingredient, triclosan. So what this proves to us is, even though we're trying to do good things and use products that are marketed to us and stuff like that, we're oftentimes adding to our toxin level when it comes to things that we're finding in our body, and being excreted, and we have no idea what kind of havoc it's been just absolutely just devastating our hormones and nutritional status and things like that. So that's a really good example I wanted to share with you guys, so that way you can kind of understand that there are so many things that contribute to your health not being where you want it to be, that so many are not actually looking for. And the only way you're ever really going to get the most out of life and resolve chronic disease, get to the true root causes of disease and things like that, is to look more deeply and comprehensively at some of what your environmental inputs would be. And of course, the way to do that is to work with a certified physician like myself, utilizing a functional medicine approach, preferably within the framework of the balanced protocol. So if you have any questions about this particular topic or things that you've seen, this type of testing, if that's something that you feel would would be something you'd be interested in, feel free to reach out to me on my website, of course, at dranthonygbeck.com. You can leave me a voicemail there, or you can find me on Facebook /Dr. Anthony G. Beck. And until next time, let's live life in balance.